First, let me say that as we had someone from the support team trying to check if everything, not seeing you, but I'm seeing you now on the on my phone. So I think everything will be well. So thank you very much for those wonderful presentations. They are very thoughtful, very insightful. You know, a couple of things came up in this presentation that I have noted, and there are also a number of people on the conference platform who were not able to join the Zoom session. And so they have put some of their questions in the conference platform. And I will urge us at the end of this session, I will urge us all to also try to log on to the conference platform, because there are a couple of things you probably we would like you to do there, like filling in the evaluation and of course, joining the wrap up at the end of this session. So thank you very much. I will start from, so I have a question from Wally Check, and he said, at this point, the VI SPDAT is not being supported or essentially ending as of the first year. So what are the recommendations related to the study given that status? So I think that that question goes to Dr. Cronley. What are the recommendations related to the study given that status?
Can you repeat what the question again? I'm sorry.
Yeah, I will repeat the question again. So the question says, at this point, the VISPDAT is not being supported or essentially ending as of the first year. So what are the recommendations related to this study given that status?
Yes, I'm aware that the consulting firm that supports the VI-SPDAT org code, they officially announced that they would no longer be supporting the VI-SPDAT in December of 2020, I believe. I don't know of immediate recommendations from, at least in the United States, of alternatives. There is a very good instrument that has been used in Washington State in the Seattle area, the DESC, I believe is what it's called. And that is something that other communities have picked up and used. I know, as I mentioned at the end, in the state of Texas in the United States, the city of Austin has actually done something similar to what Allison and Stephanie were presenting on in terms of a community-driven, really rethinking of how do we deal with housing triage and assessment. And they've created their own system as well. But it did truly leave a significant vacuum, at least in the States, in terms of what communities are supposed to do, because they're required by the Federal Department of Housing and Urban Development to utilize some sort of standardized metric to quote unquote triage and screen individuals for housing need. So some communities are just continuing to use the VI-SPDAT because they don't have another option, which I think is part of the issue here, right? Is that there's more and more evidence that the VI-SPDAT is racially and gender biased, and yet communities don't really have any other tools out there to adopt, but they're required to use the tools in order to comply with HUD federal regulations to receive the funding. So it's a very interesting gap that we're experiencing between what's required by HUD and what's available to use. And so communities are really just using what they have used or what they're able to use. But the question points out the sort of the gravity of the situation right now, that and the issues related to sort of hasty policymaking that doesn't actually have research behind it or the funding structure behind it to develop the resources that people need to comply with the funding requirements. And I can just really, I loved Allison and Stephanie's presentation. And one of the things that I've been hearing in listening sessions in the States is this model of community-driven localized processes for housing triage and assessment. More and more people are saying, we never liked this one size fits all model. We did it because we had to with Todd, but we're going to start pushing back, and we're going to make an argument that we can do that our community has its own unique identity and needs, and that we need to create our own processes. And so the conversation is moving away from a standardized assessment that's one size fits all to maybe thinking about how could we propose to HUD a toolkit that gives people sort of guidelines for how they could in their communities do something similar. So giving people tools to create their own community-driven assessments rather than giving them a one-size-fits-all assessment.
Oh, thank you. Thank you very much, Dr. Frontline. So there's another question here. So if the STARS tool doesn't provide a numerical score, how are people prioritized? That's from Amy Rennie.
Yeah, it's a great question. And I think that really gets to the heart of, I think, both of what Dr. Cronley and Stephanie and I were presenting, which is, what is this tool to be used for? And in Toronto, we've kind of taken the approach of separating out the idea of prioritization from the idea of, assessing somebody in terms of what supports they might need, helping them to navigate the system, and potentially matching them with a particular housing opportunity or follow-up services. And so those are two separate things. So the tool really isn't intended to, to do that prioritization work. It's more focused on the supports and the matching. And prioritization, we use demographic information. We've been working through kind of an intersectional process to understand how we can use data from our system to understand, what the needs are in our community and to allocate on that basis.
Right, thank you. And there is a related question from Wally. He's saying that, he's asking, is the STARS appropriate for all age groups and populations? Please explain either way.
Yeah, I think again we see the STARS tool. So it is a one size fits all tool in that sense. It's meant to be a common assessment tool. It's meant to be used with anybody kind of coming through our system. It's not meant to be kind of the end all and be all. It's not meant to sort of say this is everything that we need to know about somebody. It's just that very kind of high level. Who is this person? What are their needs? How can we best direct them to connect with the services they need? And I guess in terms of how it works with, a range of different community types, we've just been very intentional in terms of who's reviewing drafts of the tool, who's sitting at the table to help us design it. We have, Indigenous service providers, family service providers, youth service providers, kind of people across the board, the co-chair of our Confronting Anti-Black Racism Steering Committee and SSHA, a wide range of people who are really intent and people with lived experience, current service users, kind of providing that feedback of, does this make sense? Does this work? Yeah, sorry, Stephanie, I probably should have let you take that one. I don't know if you have anything to add to that.
No, that's okay. I was going to say something similar, that we are piloting the tool in different areas and with different populations just to really get that feedback. Is it being responsive to those populations and those communities?
All right, thank you very much. David is asking, how was staff involved in the process? Which frontline staff were involved?
Stephanie, do you want to take that one or do you want me to?
Yeah, I can take that. And if you have anything to add afterwards. So for our comprehensive needs assessment working group, we have frontline staff from various housing provider service agencies. So that includes Indigenous housing providers, partners with the city, shelter staff. And Allison, if I'm forgetting anybody, just remind me, but.
Follow-up supports, I don't know, it's a lot of different folks. Yeah, and in addition to that, we've done like user research. So we've gone out to Frontline and tested the tool with them and gotten feedback in various ways, sometimes through interviews, sometimes through observations of workflow, sometimes through focus groups, there's been kind of a range of different ways of connecting with Frontline, but as Stephanie says, kind of the main driver is really ensuring that, there's a good group of Frontline who are at the table with us as we're kind of developing and making decisions and doing that work.
All right. Thank you very much for those explanations. Okay, I don't have questions on the platform, but I have a couple of questions I also noted while the presentation was ongoing. So Stephanie and Alison, so during your presentation, you had mentioned that the tool is a living document. So I was going to ask, what plans are in place to evaluate the effectiveness of this tool? And maybe right after that, what are the processes in place for revising the tools?
Yeah, it's a great question. And actually, maybe this is a great one for you, Steph. I don't know if you want to take that one.
Yeah, hi everyone. Certainly, like, we want to see this tool, and right now we're kind of in the process of finalizing what the content of the tool is and really looking to translate the tool into a digital tool that can be rolled out kind of across our system, and then from there making sure that it's usable for our frontline staff, and that they can go and update the tool based on the changing needs of the person that they're working with when they need to. So it's not a situation where you go and do the assessment and then that's your assessment and it kind of gets attached to someone's file and that's how it stays for, potentially. We know what it's like to work frontline. We've been talking with these folks, that may not get updated for a really long time. So the idea is that updating the tool is actually kind of built into the workflow of your day-to-day work with someone as they're experiencing homelessness, and then that kind of allows the tool to be updated frequently, really acknowledging that people's support needs and situations change extremely frequently when they're experiencing homelessness, and that we want to make sure that when a housing opportunity becomes available and we're trying to match someone to that housing opportunity to make sure that it's a good fit for them, that it's going to provide the right supports, that we have the most up-to-date information to inform that decision about, is this actually going to get a good outcome for them and allow them to achieve housing stability over time and prevent any return to homelessness, which is really, a key part of the goal here.
Yeah.
That's such a good point in terms of a lot of the models of this triage and assessment through a standardized tool assume that there's some sort of static vulnerability that people enter in and then stay in, and they're on this housing list, with this name list, right, with the same score for months. And as we all know in the field, that's totally out of sync with the reality of persons experiencing homelessness. And so I love that point that, people's housing needs and resources and capacity shifts and changes over time, and you need to have some sort of support system in place to capture those changes so that when the housing is available, you can match them appropriately. I love that.
Thank you very much. I think Dave wanted to know if clients were also involved. Stephanie and Alison?
Yes, so we did have folks with lived experience at the table during our comprehensive needs assessment working group development phases on the tool. And they will be also supporting with piloting the tool, and we will be completing user research with clients and just getting their feedback on how they feel the tool went for them.
All right, thank you. We have about 2 more minutes here. Amanda wants to know, I think this question may be directed to Dr. Cronley. She says, I'm interested in this idea of providing support to communities to develop their assessment processes in equitable and evidence-informed way. For smaller communities with fewer resources and services, what might this look like? How can we share and build on the good work happening in other places so we don't have to start from the beginning when developing tools and processes?
I think that's an excellent question. That one thing that I think of is information dissemination and transparency in these processes. So could we create or have some sort of support for a clearinghouse of tools, right? So there are other instruments, for instance, to the VI SPDET, but how and where do you find those? It takes a comprehensive lit review to find them, because it's not like it's all just located on some, for instance, in the States, in HUD on its website. Here's all the triage tools that you can use. That doesn't exist, right? But it should if it's a HUD requirement, right? So I think the first thing would be thinking about methods of creating clearinghouses for information and information dissemination. We could also use sort of navigator models where you have community leaders who in specific areas. I know in the States, Los Angeles, Seattle, Austin, Texas tend to be leaders in these more, and San Francisco tend to approach homelessness from a slightly more client-driven, progressive perspective. So you could have these communities where people are already doing this type of work, become navigators, ambassadors, and they could go out to other communities and provide consultation and hands-on assistance, but also just using the internet and websites to create clearinghouses. And so where the work of STARS is, that could be a highlighted, on some sort of clearinghouse where we see this is the process that they did, and here's how they followed it, and here were their best practices, recommendations. You could also have workshops and conferences that are supporting this specific goal of how do we create a community-driven assessment, right? So there's just different strategies that could certainly be utilized to disseminate the information, and such that, yes, I agree, small communities which have fewer resources could do this effectively and not have to recreate the wheel.
And also, if I could just add to that, if that's okay, there is some work similar to that being done in Canada here, where we have what's called the Indigenous Pathfinders Working Assessment Tool. So that's a working group that's comprised of the Indigenous Coordinated Access Leads across Canada, and they're working to come up with kind of a best practice to be used in Indigenous communities, specifically in regard to the assessment tool. So that's something people can look out for.
Thank you very much. We're out of time, but I want to take this last question. Excel wants to know what the training process is like for workers completing the STARS with clients.
Sorry, the training process, is that what you're asking?
The training processes for workers who will be completing the tool for clients.
Yeah, so we have a draft training that we used just for the pilot to train staff who are going to be piloting the tool in a very kind of small limited test. But we are hoping to build on that and expand on that. It includes, anti-racism, anti-oppression component, and a kind of a trauma-informed lens to ensure that the tool is being administered in a way that really makes space for folks. Stephanie has been she also sits on the Indigenous Pathfinder working group that she was just talking about, and she has been bringing us some of the kind of learnings and knowledge from that to think about, I think one of our insights in doing this work has really been that, the content, the questions you ask, they matter, they're important, but what's even more important is that process, like how the tool is administered. Dr. Conley was speaking to this as well. Who is asking the questions? What is the context? What is the dynamic, the power dynamic? How do we, build those pieces into the training to ensure that that this is done in a really good way? So we're just in, I guess, long story short, we're in the process of working on those pieces right now. Stay tuned.
I would also just add to that around the training is that we're also looking for the balance between, intensive, long in-person trainings where you really get to dig into things, and balancing that with recognizing that in Toronto, as with many other communities, we have an enormous number of staff to train, and there's, we have to balance that capacity. And also, we want to make sure that the staff who are working the 10 p.m. to the 5 a.m. shift are also trained. And so really wanting to make sure that how do we deliver training to them, right? Can we deliver bite-sized, 15, 20-minute training modules to allow those folks to also have the skills that they need, to be aware, even if they're not necessarily conducting the tool, but to be aware of how the tool fits within the process. And so we're also looking to balance those two things, which is another key kind of part of the training development piece.
Yeah, it's very much a social process, right? That assessment.
Mm-hmm. Yeah, and I would just emphasize as well that we're trying to do it in a more decentralized way. So it's building on existing caseworker relationships. People have the choice. If that's not working out for them, they can go to a different location and speak with a different caseworker. So they're sort of empowered to do that work. And yeah, just I think that's part of the relationship piece, is putting more of that power into people's hands to make decisions.
Thank you very much. I guess that is it. If I allow us, we will not finish this very interesting and robust conversations. This has been very, very wonderful, very interesting and very robust. I want to thank all presenters for this wonderful work that you are doing. It's been a very